Good afternoon, and thank you for joining us. My name is Ashley Mangum, and I am the project manager for Kids Mental Health Pierce County. And I'm so happy that you guys joined us today as we continue our monthly webinar series of understanding and supporting kids and families during a pandemic. For anybody who's this is their first time attending our monthly webinars, we started these early on as a way to just provide parents and caregivers with a forum to provide strategies and support. So we want this to be an interactive process where parents and caregivers are sharing their strategies, as well as hearing from some of our panelists as well. So just to give you a brief overview, Kids Mental Health Pierce County is a coalition of people and agencies in Pierce County that have joined together to address the growing behavioral health crisis among school-age children in Pierce County. We are dedicated to developing a coordinated, responsive behavioral health system that serves the needs of children and families at the right time, in the best place, with the best outcome for every family. So we will continue to host these monthly webinars. I think the really awesome thing about this is we're able to be responsive to the community needs, and we're able to have panelists from local providers as well. And so if you ever want to participate or have ideas for future webinar topics, please don't hesitate to visit our website or contact me as the project manager. So again, we want to make this process as interactive as possible. You do have access to that chat box as well as the questions and answers section. And we want you to use that. If you have your own strategy, if you have your own ideas or tips, we want you to use that in the chat box. You can also ask questions through our Q&A section down there, and we will do our best to get to questions that were emailed as well as questions that are asked during this webinar. I will ask that everyone mute their phones or their computers if they're accessing this today. And then I will just ask that we go over some basic community agreements as we navigate this webinar today. So team agreements are really helpful when we are coming up with ways to work together in a way that honors each other and when inevitable challenges emerge. It also helps us return to that sense of an aligned purpose. So today I'm going to ask that all the participants recognize that we must strive to overcome historical and divisive biases. We are going to acknowledge that we are systemically taught misinformation about our own groups and about members of other groups. And this is true for everyone, regardless of our groups. We agree not to blame ourselves or others for the misinformation we have learned, but to accept responsibility for not repeating misinformation after we have learned otherwise. We agree to listen respectfully to each other without interruptions. We acknowledge that we may be at different stages of learning on the content and discussion topics. We agree that no one should be required or expected to speak for their whole race or gender. We can't, even if we wanted to. Everyone has come to the table to learn, grow, and share. We will trust that people are doing the best they can. We acknowledge once again that we may be at different stages of learning on the topic. And I am not an expert. I am here to help facilitate the process. I and everyone in the group are here to learn. And we may have the intent not to do harm, but some groups or individuals may be impacted. And some groups may be impacted from us bringing up historical oppressions. Are there any other community agreements that we should acknowledge before we move on to our presentation? And feel free to share those in the chat box. So without further ado, I am very excited to introduce our three panelists for today. They have been such tremendous participants through Kids Mental Health Pierce County, constantly lending their expertise and time to our multidisciplinary teams, our action teams, and really being available when asked to consult on complex cases or just ask about resources. And so I'm very excited today to introduce Laura O'Rourke. Laura is the founder and executive director of Behavior Bridges in Puyallup. She holds a Master's of Science degree in special education and is a licensed behavior analyst and a licensed mental health counselor. Laura specializes in positive behavior support and skills training, functional behavior analysis, behavioral assessment, behavior intervention planning, staff training, and crisis intervention. Laura has had the pleasure of providing consultations, workshops, and services across the United States and internationally. She has also taught graduate level courses and has been a guest lecturer for several universities. I'm so excited to have Laura here today. Our next panelist is Andy Song. Andy Song works for the state of Washington, providing clinical behavior services to both children and adults in residential settings. He has a Master's of Art degree in counseling psychology and is a licensed assistant behavior analysis, and is testing next month for his independent licensure as a LBA BCBA. Andy began his journey into the study and advocacy for autism through his summer practicum at Cornell University and through his research abroad in Tanzania on the impacts culture has on our behavior. Since then, he has gained unique experiences working in areas such as homeless advocacy, high utilizer populations, child trafficking, and adolescent behavioral health. And he also just won an award from Project Child Success for his amazing contributions in advocacy for children as well. And also, last, I want to acknowledge Betsie Walter. Betsie is a pediatric registered nurse at Mary Bridge Children's Hospital and is the autism nurse navigator at Mary Bridge Neurobehavioral Medicine Clinic. She holds a bachelor's degree of nursing from University of Washington, Tacoma, as well as a post-bachelorette certificate in autism theory and practice. In her role as nurse navigator, Betsie supports families facing autism spectrum disorder, and she helps families navigate various systems and access community resources. She is pleased to participate in this webinar, and I'm so grateful to have them. We are scheduled for about an hour today, and the format for today is we'll hear presentations from each one of our panelists, and then we'll open it up for questions and answers. I do want all the participants to know that this webinar is being recorded, so if you need to follow up, you can also access these materials after today on our Kids Mental Health Pierce County website. I also did share a link, a Google link in our chat box that has access to some of the resources that will be available. We plan to update that after today, but these are some of the resources that are going to be referenced. So with all that being said, I'm going to turn it over to Laura to start her presentation.
All right, I think everybody should be able to see this, so that's good. Hi, everyone, I'm Laura, and I get to have the fun tasks of starting off our presentation and also finishing it with some crisis. So as Ashley stated, Betsie, Andy, and I represent people in the community who have a personal or professional interest in supporting the autism and DD community. And these tips and characteristics and strategies that we're providing are best practices in any setting, but are especially helpful with communities who have communication issues or who experience developmental disability or autism. And so none of the things that we're saying are universally applicable for all people, but they're good general practices that we hope you'll find helpful and successful for you. So I want to just start off with us talking about some proactive interventions in the home and community that you guys can do to support somebody who you care about that could be helpful in addressing some of those needs. So some of the things that we've talked about, I know the people in the home and community, the Kids Mental Health Pierce County community have realized is that people with autism and developmental disabilities make up a significant portion of the people who are also accessing behavioral and mental health. And so some of these statistics are out there for you guys to understand the level of impact that autism and developmental disabilities play in our local community and in our behavioral and mental health community, and those intersections that are really critical for either camp, if you happen to be more into mental health and behavioral health areas, or community providers, versus somebody who experiences or supports somebody who experiences autism and developmental disability. These statistics are fairly staggering. So there's a few things that we can do that are fairly simple in theory to prevent crisis. And so everything that we can do to prevent crises really fall into these 4 components: environment, motivation, communication, and behavior management. So let's talk about environment a little bit. Some of the tips that are really helpful to help support somebody in their environments and also avert potential crises that could happen from miscommunication or other things that Andy's going to talk about is minimal crowding and distraction. So when things are really overwhelming and crowded and there's lots of things going on, it makes it difficult to focus, and it can lead to crises and confusion. And so minimal crowding and distractions is really important. Also, having clear visual boundaries can contribute to preventing crises and supporting best practices. Having things in your home or in the community or in your setting organized and easily accessible, and knowing what you need and being able to utilize that and get to that sooner than later can be really helpful. It's also really important to make sure that your expectations are clear, and that there are routines and procedures that can be predictable and reliable. And that predictability and reliability can be really helpful in supporting autistic and individuals and people who have developmental disabilities, because it helps clarify and makes it more concrete rather than abstract or something where a person may need to interpret communication or social cues or body language. So having expectations and procedures and routines clear is really important. It also can be really helpful to have those things posted and visible. Same thing with schedules. Does the person know what to expect and when to expect it and what's going to happen? And having an idea of what that schedule is going to be or what that routine is going to be can be really helpful. Good traffic flow. So that means just having enough room between yourself and others and trying not to have a lot of crowded, close contact if you have somebody who's more prone to crisis, and making sure that there's opportunities for that person to be able to access a break or access places within their home or community that are going to be safe, and making sure that there's not boundaries or barriers in between that access to safe options. Giving people choices is always a good idea, and making sure that those choices are something that's meaningful and relevant to the person and their own lives and their own culture is really critical. And finally, frequent positive attention. Catch that person being good. What is it that you're seeing that is going well and that person could learn to do more of to access their needs? And Andy's going to talk about that a little bit more, but lots of positive attention and positive care for those things that we'd like to see more of, rather than focusing on the negative stuff. Motivation's another piece that's really important in being able to prevent behaviors. So one of the things that we need to ask is, what's in it for this person and why should I care about it? So they need to have that answered for them. And anybody doing anything needs to know, why do I need to know about this? Why do I need to care about this? I know when with my kids in school, they're like, well, nobody looks and nobody cares and nobody's even paying attention, so I don't need to worry about it. So whenever we're providing these supports, we want to make sure that the person that we're communicating with understands and knows, and that it's meaningful for them. Why should this be a different option? We want to be specific about the behaviors that we see, and also be specific so that we can model things that are positive that we want to see more of. If we do have to have feedback, we want it to be brief and specific, and using first then language, such as first we need to get our math homework done, and then we can have an iPad, and then you can have some time with the iPad, is a strategy that can be really helpful. Next, we need to have a continuum of strategies to respond to inappropriate behavior. So we don't want to go all the way to the last thing on our list. We want to start with what are things that are easy and simple and hopefully positive and successful first. Try to exhaust all of those options before we start getting into other things that are a little bit more complicated. And then we need to know who our team is. And so that's something that is really important across supporting anybody in our community is who are our community partners. And this community is a great group of people who have lots of resources. And if you need help connecting with community members or team members, we're a good community to try to coordinate with. Communication is another piece in preventing behaviors. So one of the first things that's absolutely critical is making sure that you build rapport with that person and trust. We can't do anything without rapport and trust. And I know Dr. Laddish had presented with Kids Mental Health Pierce County a while back and talked about how behavior is communication. So when we see behaviors that we think are challenging or problematic or awkward or whatever, that anything that we do is a form of communicating with our environment, different things that we need. Are we happy? Are we sad? I need something. I'm good. And so really reading those behaviors and what is the person trying to say? What is that message? And how are we going to choose appropriate language so the person that we're communicating with understands what we're trying to communicate as well? And that's going to vary for different people. We want to make sure that when we explain things, it's clear and in the language that that person will be able to absorb. And there's lots of ways that we can communicate without words and that people communicate to us without words. There's gestures and body language and eye contact and facial expressions. And there's all sorts of messages that can be displayed through body language. And so being aware of that and also being aware of what your body language is communicating. We want to make sure that we're considering culture and the history of that person. And that includes positive histories with their environment, trauma histories. All of those pieces can affect a person's environment, affect their relationships with others in their environments, and can also affect behaviors that we might be able to predict and help support. And with any person that needs some extra supports, or any person at all, visuals are always helpful. Think about when you're looking at what you're going to do today, or when was this meeting today? When was this webinar? You looked at a calendar. That's a visual support. And so having multiple ways to communicate with each other is really important. And that is valid for anybody, and especially valid for somebody who may have some more communication challenges. The last thing that I want to talk about for proactive interventions is behavior management. So there's lots of different things that we can do to prevent behaviors from happening. One is making sure that those expectations and procedures and routines that we talked about with the environment structure are taught and retaught. And it is okay if you're constantly working on practicing things that are important, and that this is when dinner is, this is when we're going out to the doctor, this is when we're going to get McDonald's, and having those procedures taught and retaught and practice is really critical. One of the things that we know about crisis is that new skills are one of the first things to go in a crisis, and people generally default to the things that they know to be successful over a long period of time. So people are going to go to their defaults, and it takes a lot of practice to be able to perform new skills in a crisis. And so that's something that's really important, to practice those skills when you're calm. Scheduling activities, review them daily. What's happening in our day? What are we going to do today? What's going to happen tomorrow? And having that schedule reviewed on a frequent basis is really supportive. Using prompts and pre-corrections to increase appropriate behavior. So an example of this might be, remember, we're going to get out of the car, we're going to walk calmly through the parking lot, we're going to put our mask on, we're going to get these 3 items from Target, and then we're going to pay and leave. And this is what I want to see. I want to see calm walking. I want to see safe hands. And then when we're done, we'll get to go home and relax. And so that's an example of using pre-corrections. Active supervision is another really important thing. If you know something is probably going to happen, a really good way to prevent that is to just kind of keep an eye out and keep monitoring for things that could occur. Is the person actively engaged throughout the day? We have a lot less things and activities going on right now in COVID. And so how are we going to build a meaningful schedule and a meaningful routine so that boredom doesn't set in? And how are we going to make sure that there's things to be engaged in throughout the day? Are there opportunities to interact with other people? That can be a really helpful behavior management strategy as well, is just to know that you have opportunities to hang out and interact in multiple ways, whether that be through Zoom or phone calls or video chats or visits through the front door of your house or what have you. If things need to be changed or adapted, it's fine. You can change things and adapt. And that's where having those procedures retaught and modified and schedules reviewed, all of those proactive measures help incorporate things that we can do proactively to manage behaviors. And finally, what are the things that are going on that are meaningful for that person? Activities are something that that person cares about. All right, so those are some very quick tips on proactive interventions for crisis. And now it's Andy's turn.
Thank you, Laura. And don't forget to use that Q&A box if you have questions. We're happy to have all of our panelists come up at the end to answer those questions, as well as that chat box as well.
Great, thank you, Laura. Let me get this PowerPoint up. All right, is everybody able to see my screen?
Yes.
Okay, perfect. Hi, so again, my name's Andy. Thank you guys so much for being here today. And then also for Laura for giving us a lot of proactive steps that we can take to ensure that we're providing as much support and guidance to children and families during this time as possible. So to continue on with the topic of how do we support our clients, our families, loved ones, and children at home using different behavior modification strategies. This presentation is going to be a really quick run through of just ABA 101. We weren't really sure what the participant was going to look like. And so for a lot of you who are clinicians or who do have some background in ABA or other positive behavior supports, I apologize, this might be a repeat. But if you're like me, these refreshers are always really helpful. All right.
Hey, Andy, it's Ashley. I just wanted to let you know if you wanted to turn your camera on, we just see the PowerPoint right now.
Okay, well, it won't go to the next slide. Oh, there we go. Okay, so for today's message, I just wanted to briefly reiterate some of the points that Laura made earlier. So this is not an assessment or clinical advice to addressing any case-specific target behaviors. We just don't have the time, and then ethically, that's just something that we can't commit to. As much as today, I wish I can give everybody the answers or the magic wand to solving some of the difficulties around behaviors. That is not our intention today, but hopefully through the presentation, I'll at least be able to give you guys some general tips and strategies that are pretty generalized that can be used across multiple settings. So these are general ideas for responding to target behaviors. The content in this presentation is to spread awareness of what behaviors are and how people communicate through behaviors. And again, just a reminder, the goal is never to fix a behavior, but rather how do we understand the behavior and understand what the communication is behind the way that specific person is acting in order to get their needs met. So first off, with any behavior skills training or any time we're trying to teach an individual a new replacement behavior skill, we go through what's called a behavior skills training or a BST procedure. So the first step is we have to identify and define each skill to teach. If there is a target behavior that we're really focusing on, we have to first be able to identify, well, what are they communicating? And then secondly, what's a developmentally and age appropriate replacement skill that we can teach them? Then step 2 is we have to identify all the relevant SDs. And this is just a fancy ABA term for discriminative stimulus. And so these are just all the different, I guess, elements or factors surrounding an individual's circumstances that may trigger or make the behavior a little bit more likely to occur. Then under step 3, we assess the learner's baseline. We have to understand what is our learner capable of doing, and then being able to match them with developmentally and age-appropriate replacement skills. Then the 4th step is we provide verbal instruction. So once we've identified what the behaviors are, what replacement skill it is that we want to teach them, we now have to go into the actual instructions piece. And so the first step in actually implementing some of these strategies is first we give them the verbal instruction. We'll walk them through and verbally tell them what it is that the expectations are and what skill it is that they're going to be learning. Then the next step is modeling. So after we give them the verbal instructions, we're now going to be showing them. We're going to act out and help them understand visually what it is we're actually asking them to do. Then the step 6, we move on to rehearsal. So now that they've had the verbal instructions, they've seen what it is that the replacement behavior looks like. Now we give them multiple opportunities to learn, practice, and rehearse this new skill. And then step 7, we provide feedback. We provide very objective and informative feedback. This is not a time to criticize or talk about any of the negatives or challenges around the behavior or placement behavior skills, but rather providing them with insight into their performance, how they're doing, areas where they can improve, and then just giving them multiple opportunities to go back to that rehearsal phase. So now that we're talking about behavior, I wanted to make clear and also put it out what is a behavior. When we're talking about behaviors, we also have to understand what is a behavior? What does behavior mean? So one way to think about behavior is applying what's called the dead man's test. And what that means is if a dead person can do it, it's probably not a behavior. It's anything a person says or does. It must be observable and measurable. And so moving on, now we're going to be talking about target behaviors. Some of the other synonyms or AKAs, as we call them, for target behaviors are called problem behaviors, challenging behaviors, maladaptive behaviors. These are those behaviors that first interfere with a person's ability to learn. It may cause injury to the individual, it may cause injury to others, or it might cause property damage. And then also to put out some more additional terms, when we're talking about any kind of behavioral supports or interventions, one of the tasks that we have to do as the person who's providing the intervention or support is we have to understand the difference between behavioral terminology and mentalistic. When we talk about behavioral, these are things that are observable and measurable. And so when you're seeking guidance and support, whether it's you reaching out to your ABA clinician or any kind of therapist, psychologist, and we're trying to describe some of these behavior, one helpful tip is to try to be very objective, observable, and measurable, rather than mentalistic, which is expressive. These are more descriptors, our perception or subjective views on a behavior. And what that means is when we're trying to describe a behavior to our supports, we really want to avoid using the mentalistic terms such as angry, mad, sad, happy. These are terms that are very subjective and can really have a lot of implicit bias from the recipient who's getting this information. And it could really be cloudy and foggy in terms of how do they now put all these pieces together, take your situation, and then provide you with the advice and consultation that you might need. Whereas if you can be a little bit more discrete and observable and measurable and objective through behavioral terminology, such as so-and-so grabbed something off the table and threw it across the room and it shattered. Whenever my child is nonverbal, we assume they're angry when they scrunch their face, grind their teeth, and make a fist. These are a little bit more descriptive words that we can use when we're working with some of our service providers to kind of help navigate what it is that our client or child might be facing in order to better provide the clinical perspectives on what type of intervention might be most effective. So continuing on, This goes into the ABCs of behavior. And what that means is ABC stands for antecedents, behavior, and consequences. Antecedents means what happened right before the behavior, or what was the trigger. Then B, behavior, what did the person actually do? And then C is consequence, or how did you respond? The action that immediately followed the behavior. And then we also have to take into consideration of the setting events. Setting events are any condition that that sets up the likelihood for a behavior to occur. An example of this could be if I woke up today with a migraine, that could be my setting event. The migraine or headache alone doesn't cause behaviors, but it puts me in a situation or a condition where me lashing out at somebody because of this pounding headache is more probable and likely. And so when you're trying to analyze and assess the behaviors of your child or client or a loved one, try to figure out, is there a setting event? What were some of the conditions, both internally and environmentally, that might be contributing to further exacerbating that behavior? And once we've identified what our replacement skills are, what strategies we want to use, and now we're starting to get a little bit more understanding into a person's specific behaviors, the next stage is we really want to identify what the function of the behavior is. Like I mentioned earlier, anything that we do, any of our behaviors is a method of communication. We act differently to communicate different meanings. And behind every meaning, there are 4 functions of behaviors. It could either be sensory-based or automatic. So sensory could be loud sounds, lights that might be bothering us. Automatic can be, think of if you have a bug bite and it itches and we scratch that bug bite. That's an automatic or sensory function. Escape, doing something to escape a person, a situation, or a physical environment. Behaviors for attention, to get somebody's attention. And then the 4th one is tangible or access to tangible. We behave or do a specific behavior in order to obtain something. And so this is just a little bit more clarification to the 4 functions of behaviors. One acronym that makes it easy to memorize is SEAT, for sensory, escape, attention, and tangible. And so I just put this up here, and then Ashley is also going to include these PowerPoints so you guys all have access to it, but this is kind of just a little side piece I wanted to include for everybody. And so how do I know what function a behavior serves? And so I did my best to try to break this down into very quick snapshots into what you guys can do to identify what possible functions of behaviors are. Because if we don't know what the function of the behavior is, it makes it kind of hard to find the right or appropriate intervention strategy for that target behavior. So step 1, refer to the ABC data collection. And the reason why we do this is because the ABC data collection can really give us insight into patterns of behavior. Is there a consistent antecedent or a trigger that's always happening following a behavior? And then what's maintaining that behavior? We would look at that by the consequences. Are you responding consistently to that behavior every time? If so, you're more than likely reinforcing that behavior through your actions. Step 2, look for a pattern of consequences. So this is your response to the behavior. It may be unintentional and it may be well-intended, but sometimes we may inadvertently reinforce target or challenging behaviors without the intention to actually doing so. And so to identify what the functions of behaviors are, what behavior serves, the first one is attention. If there's a target behavior and it involves another person and then the target behavior continues, more than likely you're probably working with access to attention. If there's a target behavior and then there's a change in location or event or person, and the target behavior always occurs during the same location, event, or with a person, more than likely you can assume that might be escape function. If there's a target behavior and it happens in a wide range of settings, and one of the big takeaways is, does this person engage in this behavior regardless of social interaction? you're more than likely going to be working towards sensory. And lastly, if there's a target behavior and then that person gets something tangible or physical, and then the behavior briefly goes away, and then we see that target behavior again, and if that cycle repeats, then more than likely you're working with access to tangible. Again, these aren't set in stone. These are just very brief snapshots of possible ways of identifying the functions of behaviors. And so the next thing we want to do is ask ourselves, WTF? And so you're probably wondering what that acronym means. So when a client is engaging in a target behavior that requires intervention, just remember WTF, or what's the function? Going back, and I'm really going to emphasize this a lot, but we have to do our best to try to figure out what's the function of that behavior. Why is this person doing what they're doing? Knowing the function is critical to preparing how we respond to target behaviors. And we don't want to unintentionally reinforce behaviors through our actions. And so just some reminders when we're responding to target behaviors or challenging behaviors. We always want to stay calm and have the client match our tone and posture. So stay calm. Number 2, use a calming tone of voice. Number 3, scan the environment for safety. Above all else, the safety of yourself, the individual, and then anybody else nearby or within close proximity will always take precedence over actually implementing or following through with a behavior intervention plan. So make sure that everybody's safe. Number 4, ask yourself, what's the function? And number 5, remain patient while working towards redirection or de-escalation. So some of the common target behaviors that many of you guys may have experienced or are currently experiencing and trying to work through may include physical aggression. This may look like an individual hitting somebody with an open or closed fist, throwing things, breaking things, verbal aggression, property destruction, elopement, or running away, response to internal stimuli or private events, or sexualized behaviors. And so some common intervention strategies that you may be able to employ during these different situations include functional communication. So this is where we, the replacement behavior is teaching somebody how to appropriately communicate their needs to replace a target behavior. Whenever we're doing any kind of behavior intervention strategies, the biggest thing to remember is that there has to be some kind of motivation behind it. The reason why people engage in a behavior is, I mean, there are many reasons, but some of the common ones are years and years of reinforcement, basically meaning this has worked for them. It's easy and it gets their needs met in a simple and fast way. And so if we want to replace a behavior, the biggest thing to remember when you're using any of these intervention strategies is that this replacement behavior or the replacement intervention strategy has to get the client's needs met much more quickly, and it has to be easier for them. So another one is environmental modifications or making changes to the physical environment of the client's living arrangement. We could do tolerance training, reinforcements versus punishments. I know this is one that really gets a lot of people hung up on the terminology, but we'll get to that in the later slides. Token economies, making sure that there's a consistent routine, modeling the behavior. Whenever we're teaching a skill, we want to make sure that not only are they hearing the instructions, but they're also seeing the instructions. Using shaping and chaining, using task analyses, or visual instructions is another way to think about it. And then the differences between using an antecedent versus consequence intervention. Are you doing an intervention before the behavior happens, or are you doing an intervention after the behavior happens? And so just some general strategies to try that are universal and can be generalized across multiple settings and conditions is I've worked with multiple clients where music and TV really helps calm them down, stops them from ruminating. If you need some quiet space or during downtime, just having some ambient sound in the background can really help drown out a lot of the internal stimuli that a client might be experiencing. Another helpful thing that's worked for us is colors and temperatures of lights. In one of the facilities I work with, we've replaced every light bulb with hue light bulbs or color changing light bulbs. And so by setting the temperature or the tone of a room can really help shape a behavior. One common way that the different colors and temperatures of lights are used is through sleep routines. We'll start the light very bright, and then over the period of an hour or two, we'll gradually reduce the temperature of the light. We'll change the color of the light from like a soft white to then a soft blue, and then eventually fading it out. Having a token economy. Give a reward-based system or some kind of system where the child can stay motivated to work towards a larger goal by smaller incremental goals. Examples of token economies can be a sticker chart. Every time they complete one task, they get a sticker. And then with these small increments, they can work their way towards a bigger prize. Rearrange the furniture. It's amazing what can happen to just any of our behaviors, our emotions, and just the way that we perceive the area around us. If we just, channel that inner Marie Kondo of yours and have a new layout. Another one is what we call the penny game. Sometimes with young children who have autism and who have high energy and just need a lot of attention, I know sometimes, especially during the COVID era, that's not always possible. One thing that's worked with some of our more high energy kids is we created what's called the penny game. We'll literally hide pennies throughout the house. It gives them something to focus on, something to fixate on. It's a goal, it's attainable. And then at the end, once they found all the pennies, they get a prize. And then the use of aromatics and scents. It's amazing what different aromatics and scents can do, especially for nighttime routines for some of our kiddos that we work with. We use lavender sprays. We'll spray the pillows and blankets with lavender. And we really want to try to target and induce a lot of the other senses into our behavior intervention strategies. And so try different scents, candles, different scented sprays. And then, oh gosh, I'm losing my word for what the other things are called. But I will get back to that. And so some of the big takeaways is we need consistency. Oftentimes intermittent reinforcements can be our downfall. And what that means, or the definition of intermittent reinforcement, is that these are the behaviors that we reinforce every once in a while. So think a good example that really helps me think or remember what intermittent reinforcements are is think of gambling. Why do we sit in front of a slot machine and why do we continuously press the lever over and over again? It's because there's that slight chance, that one-off opportunity that we know we're going to hit some kind of bonus. There's going to be lights. It's going to be fun. Same thing happens when we're trying to provide any kind of interventions for target behaviors. If we're not consistent with our message, the child or the client may lose that motivation because over time, intermittently, what we're teaching them is that there may not always be a punishment or a consequence to a behavior that this behavior may be worthwhile to hold on to because there's that small chance that I know that every couple hours, mom's just not going to follow through. And so just really driving home the idea of consistency. Again, asking yourself, WTF, what's the function of the behavior? And this is not a one-size-fits-all scenario. Sometimes we have to try multiple strategies and interventions to really see what's effective with the client that we're working with. And then just also for each parent, clinician, service provider out there that's working with somebody who has really rough or challenging behaviors is to identify some of your own mindfulness techniques and your own self-reflection. How do you get yourself to a space where you can then implement these strategies? If we're in crisis ourselves, then more often than not, we're going to be contributing to the crisis that's happening within our homes or within our clinical settings. And then utilize your supports, your resources, and just a reminder that you're not in this alone. Just looking at this webinar alone, there are many individuals across multiple spectrums of behavioral health that are here. Reach out to those supports and see how you can partner with others to support your loved ones. And then also to remember that you are the expert on your child, specifically for parents, to believe in yourself, to trust, and to carry on. And then I do have more, but I do see that my time is well over. So I'll stop here. But this PowerPoint will be shared from Ashley. And then afterwards, if there's any other questions, please feel free to reach out. I do apologize that a lot of this material had to be rushed. But again, I really want to respect everybody's time here today, and I want to stick with my allotted time slot. So thank you.
Thank you so much, Andy. And it was a lot, we had a lot of content to cover in a short amount of time. So I'm going to transition to Betsie, who will be giving us some strategies on how to navigate when your child and family does need services.
Thanks, Ashley, and thanks, Laura and Andy. Both have given just a wealth of information and helpful suggestions. I've been taking notes the whole time you've been talking. So what I'm going to do now is move, as Ashley said, move into talking about accessing resources, whether it's during a time of calm, or maybe it's a period of increasing escalation, or maybe it's actually when you're in crisis. So I'm going to go ahead and pull up my PowerPoint here and just go ahead and go right into it. And again, behavior is communication. You know, that's just our little, that's a phrase that we use continuously. What does the individual want? What does the individual seek to avoid by the behavior? What is the individual communicating? As coming from the place of medical services, is there an illness? Is there pain that's going on that's maybe contributing to behavior escalation in this little one? And especially if the individual isn't necessarily able to clearly articulate, or maybe has an under-registering or an over-registering of a level of pain and or illness, just not feeling well. So doing a little bit of detective work to make sure and rule out that there isn't anything physical going on. Is it an unmet need such as hunger, thirst, or fatigue? If the child is taking medications, are there recent changes to medication regimen? Or is this person experiencing side effects from current medications? All of that does need to be considered. Is there stress related to difficult situations, such as transitions, new routines, being told no? And we all are acutely aware of how very, very different our daily routines have become over these last couple of months. And then also important, how does this individual show signs of increasing stress? For instance, is there an increase in repetitive behaviors in kind of a subtle way? Are there verbal repetitions over and over again that are not necessarily in context to what's going on? Is there an increase in stimming behaviors or the self-injurious behaviors? All those can be pointing to escalation. Again, is the individual facing difficult social situations, being told no? Are they being redirected from a preferred activity that may be serving as an actual effort to calm? Are there unfamiliar people and surroundings, or again, changes to the routine? So when you're noticing that something is different, something is changing, think about utilizing your resources. It's always okay to call and ask for some input from the providers who know the child and can maybe recognize that there's some changes that should happen. Contact the medical providers, and that includes both a primary care provider as well as any specialist. Contact the therapy providers and ask for assistance. Hey, I'm noticing that this behavior is going on, and is there anything we can do in therapy to help with that, or dig a little deeper? That would include occupational therapy, speech therapy, and your behavior therapist, as Laura and Andy have so beautifully talked about for us. And then utilizing the other sources of support. And by that, I mean the other people that that you can contact to come on over, maybe help in support of this individual, the other children that might be in your home, maybe take over for a while to give you a break, give the caregiver a break so that they can kind of regroup and figure things out. When everything that you try and you've tried everything and it's just not changing things around and crisis happens. Crisis is when the individual is no longer safe to themselves or to others. And signs of the behavior crisis can include, not always this, it's very individualized, but can include physical aggression towards the self or others, hitting, kicking, biting, throwing of objects, damaging the surroundings, eloping, running away. When that happens and it has escalated to where your resources are just not effective, and that is no fault. Sometimes it just happens that way. We do have our local emergency department to help with assessment of what's going on, triaging the severity of the situation, and to provide the family and the individual with safety as well as support. It's really important to not attempt to transport by private vehicle if it feels unsafe. If there's a possibility that the individual might want to escape, and you're driving in the car up I-5, don't try to do it. Contact your local emergency medical services or 911. Some things about calling 911 is, number one, understand that it is not a punishment of this child's behavior in any way, that it is, the purpose of contacting them is to get the help that is needed for that situation. It's very important to explain that the individual has special needs when you're calling, to explain specifically if there is a mental health condition or the developmental disability. Explain the individual's communication pattern so that they have a little bit of an understanding of what to expect when they do arrive. Will this person use language, or will they be using a communication device, for instance? And then also, as Andy said, remove those dangerous objects from the immediate surroundings. The individual and their caregivers provide crucial input that helps others who don't know the child understand their behaviors. So what's really helpful is to convey what are the individual's typical patterns of communication. Is their communication device that's in use? What is the best way to approach the individual that will cause the least distress? Is the individual sensitive to those environmental things like touch, sounds, sights, smells? Again, does the individual under over register sensory input? What is calming and soothing? Is there an attachment object? And if it's safe to have it, is it present when you do come for emergency services? And then again, what are those signs of agitation and irritability that I mentioned a little bit ago? During admission, and this is when, what I mean by admission is in the emergency room. And again, this is generally what will likely happen, but I'm speaking generally again, but a plan of care will be developed. The plan of care will be individualized to that person. The plan may or may not include ongoing hospitalization. It depends on the triage and the assessment of the individual. And the plan will or should include involvement of crisis support resources that can be utilized after discharge from whatever setting you're in. So that's kind of how it can go. Once things kind of settle down a little bit after the storm, so to speak, there will be recommendations, whether it's a discharge from the emergency room or from a hospital stay. It's really important to access any services that have been recommended. That can include, but not necessarily always, but can include therapies such as occupational therapy, speech therapy, ABA therapy. Begin or continue to access mental health and behavioral health services. Utilize any community supports that have been arranged because of this particular episode, and that can include in-home support services that do continue once back in the community. And then it's really important to continue follow-up with the individual's medical providers. And that does include your primary care provider, as well as any specialists that are involved in the individual's care. And then it's really important to prepare for next possible moments of escalation or crisis. I think that we've mentioned it, but again, develop a written plan that that you can access, and it doesn't have to be anything fancy, but include who you can contact for immediate help, such as your family, friends, neighbors, and include their contact information, phone numbers for crisis line and other community support agencies that might already be involved. And then develop this plan in conjunction with your care providers, such as your ABA therapist, for how you will respond when a behavior escalation develops. So there's something tangible to refer to when things are really escalating. Also create a safety directions for the other members of your home so that everybody can be as safe as possible. And then be sure to share your plans with your support contacts. And then just a little word about caregiver support, that caring for a loved one strains even the most resilient of people. And the risk for caregiver fatigue increases with social isolation, financial difficulty, and when increased time is devoted to caregiving. I think we're all pretty familiar with the impact of social isolation. And many people are experiencing changes to their financial situation related to job changes and so on. So it's just really important to ask for help and accept help. Focus on what you're able to provide, and don't give yourself extra stress for what you may not be able to provide. It's really important to take care of your own health so that you can avoid the caregiver fatigue as best as possible, and engage in relaxing activity as much as possible as well. There's like just a wealth of community resources that are available. Many agencies have developed extensive resource lists to help families through this time of pandemic. What we've done is put together a list of agencies that have compiled links to different topics, and so this will be, Ashley's going to add this to the chat box resource, so that as another reference. So it lists the names of our main agencies and advocacy groups that will have links to a variety of different topics. So that's kind of what I wanted to share.
Thank you, Betsie, so much. And I have this information will also be on the Kids Mental Health Pierce County website. We have about 15 minutes left, and we're going to have some closing strategies for when a crisis does occur for Laura O'Rourke. So that gives all of our participants plenty of time to ask any questions in that Q&A box or in that chat box. And I'm going to transition over to Laura at this time.
Thanks, Ashley and Betsie and Andy. Amazing work. I appreciate it. So I'm going to try my screen share one more time and see if it'll work. Let's see what we can do here. Can you see it?
Yes.
Hey, that's exciting. For those of you that missed it, I didn't turn it on last time. And so the presentation will be up on the Google Drive. With some extra visuals for you. So this is something that I wanted to show you guys. And part of it is to show that there's a cycle to crisis. And one of the reasons is to show that it doesn't necessarily happen within a bubble. You can see there's your baseline where everything's calm and fine and happy. And you don't get to crisis in 0 to 100 most of the time. Sometimes it does look like that, but there's usually some other things escalating or bubbling up that are contributing to that crisis that we can pull out and figure out what we can do to prevent that. And so that's where those preventative strategies are really critical, is in this escalation and baseline phase. And then you end up in a crisis, and this is that culmination place that Betsie was kind of talking about, that could lead into emergency departments or other emergency supports and crisis supports. And so the cool thing about crisis is that it can't last forever. So all crises have to end at some point. And so that's one thing that I know when I've been in crises, I just have to remember, This isn't going to last forever. It will be over soon. I don't know when, but the more information we have and the more data we gather, the better we can predict that, so that we can maintain our own control and safety and composure, but also help support that person who's in the crisis. And then after a crisis, you have this de-escalation phase where you're not out of the clear yet. We're not calm. There's still a lot of things happening and kind of starting to simmer down. And you need to have that de-escalation piece too. And after that, there's this piece of moment of time where you can have this post-crisis intervention. And that's really critical time to reflect and plan and come up with strategies so that you can try to prevent or at least minimize the crisis that could occur next time. And that's where you can plan all of those prevention strategies that we talked about earlier and come up with what needs to change and what needs to shift. This is something that I do with people that I support. We basically use that same graph, but then we come up with a fill in the blank of behaviors and emotions and environment issues and responses that are either positive or negative, that are maybe things that we do, things that the person does, things that the environment does that contribute to each of these phases. And it's important because people act and behave and think differently, and the environment can shift depending on what phase of a crisis you're in. And the more you know about each of those phases, the more you can predict. So I know this looks like a lot, but I wanted to just put it all out there so that you have the information to reference. But there's lots of ways that we can minimize crises in the moment and try to get back to calm as fast as possible. So the first one is to stay calm. You don't have to be calm. You just have to look calm and act calm and kind of play the part of I'm calm, I'm slowly talking in reassuring tones, my voice volume stays here. We know that if you raise your voice and then it just keeps going up and up and up. So we want to keep that model of this is what we want to see and this is how we want to show behaviors that we want to see modeled and repeated and try to keep ourselves out of the crisis as much as possible. It might be hard to communicate with that loved one. So we want to make sure that we have those alternative communication strategies at least thought out, and what can we use as backups and things that have worked in the past. And it's okay to repeat yourself. That repeating can be reassuring and comforting, but again, if you stay calm, don't take actions personally or hurtful words. That a lot of times people will say and do things that are part of the crisis. And so we can talk about that. We can unwrap it. We can do lots of things later, but the crisis isn't the moment to do that. We want to get out of the crisis. And those are things that we can do in that post-vention debrief phase. Things you can say: I'm here, I care, I want to help. How can I help you? Show me what you need. Help me understand. So those are some words you can say. Try not to say things that are more aggressive or confrontational, like snap out of it, get over it. Oh, it's not that big of a deal. And you want to try to use your team. Betsie talked about that a lot. We also don't want to threaten things like, I'm going to call 911 if you don't stop, for example, unless you are intending to do so. So it's important that when you do set limits and that you're clear and firm, but also that there are things that you can follow through with. Things that you can do to verbally de-escalate. So one is to just respect people's personal space. Personal space increases in a crisis. So your normal space is about 3 feet. And so you want to try to increase that to maybe 10, 15 feet, depending on the complexity of behaviors, because the easiest way to have aggression come at you is if you're in that person's bubble. And so we want to get out of the bubble. Establish verbal contact calmly and be concise and speak short, easy to understand phrases. Listen to what the message is and what is that behavior trying to communicate, and then try to interpret that. I see that you are frustrated. I see that you are mad. I understand that's hard right now, but we have to stay safe. And these are some things that we can do. Then after, you can do that post-vention. Some things you can do with your own body language to help minimize a crisis is maintain eye level at all possible. If you're hovering over or you're kind of over that person. It's intimidating and confrontational, and it can be helpful if you try to stay at eye level. We talked about physical space. Don't stand full front to that person. You want to try to have an angle, so that can also help be non-confrontational, but to also express opportunities for you to be able to move if you need to in a crisis. Allow that person to break their gaze. They don't need to be looking at you the whole time. We need to be practicing coping strategies and ways to stay calm. Try avoiding confrontational gestures as well, like pointing or shaking your fingers. Smiling can be interpreted in a crisis as laughing at somebody, so you want to try to stay pretty neutral. Keep your hands visible and non-threatening, like Mr. Man picture here, and try to appear confident and relaxed. Andy talked a lot about this, but I had my own steps for things that you can kind of fill in the blanks as you're working through that plan after a crisis. And you want to make sure that you're debriefing with that person, but also with your team, looking for patterns or things that are missing or needs that weren't necessarily met. You want to write things down and try to include as many details as relevant. You don't have to write everything down, but just a notebook of, hey, these are my thoughts about the facts that happened. Work with your team and make sure that you try to have a plan that's something that's doable across everybody and everywhere. The more consistent we can be, the more predictable and successful we'll be able to figure out what's working and what's not and come up with a better plan every time. Then we want to return that control back to the person and make sure that they know that that was in the past and it's a new day, it's a fresh start, and we can move forward and get back to all of those positive and preventative things that we talked about. I added some resources that I've found helpful over my career that have a lot of different variations of things in them. So if you need any, like, I don't know what I'm doing, here's some things that I found helpful. This is my contact information if you need anything from me personally. And we're going to open it up now to questions and answers.
Thank you so much, Laura, for that presentation. That information was extremely helpful. And I'm going to invite Andy and Betsy to come up front. And we did receive some pre-submitted questions as well as a question during today's training. And so I'm going to ask this first question. What are some of the strategies or tips for working with autistic students who are out of their school routine and don't have access to their normal services?
I can speak to that first. So one of the things that I have found really helpful is building a routine. So it doesn't need to be a fancy routine. It just needs to be something that is predictable and put out there. And so I can share one of the slides that I meant to share, that of a routine that we put together. Can you see my screen?
Yes.
Let me find it. Okay, so here's one that I put together for one of our families specifically because there was not any time, there was no school, there were no activities, and we needed to fill the day with meaningful things. And so we just laid out a super generic schedule, and you can see it's very simple and there's lots of options. So it doesn't need to have all sorts of things. I mean, one of them is for a whole hour. You can play videos, hang out, and do physical therapy stuff that, you know, they sent us 6 months ago, and jump on the trampoline. Okay, fine. But it's structured in and it's predictable and it's something that we can hold on to. And so you can build a really nice generic schedule with lots of options and lots of things to go back and forth with. But sometimes that's really helpful and comforting to somebody who's lost all of their structure, is bored, doesn't have enough things to do, doesn't have enough to engage them. And also it helps structure and limit times for when to do things so that it's not just this free for all of you can do anything you want for however long you want. It helps compartmentalize your day, and that can be comforting and helpful. So it's more about building in the structure rather than it being anything really specific or difficult or otherwise.
Thank you. Betsie, were you going to add something? If you are, you're muted.
Oh yeah, I was just going to say, in addition to what Laura was saying about having the predictability, having a schedule, and having something concrete for the child at home, I'm really big into living arrangements based on the environment. If this is something that people have access to, and if it's something that you're able to work with, I would also focus on identifying specific areas of the home or your environment, specifically for education-related tasks. One thing we often want to avoid is to have a place become aversive. If school is something that you know that your child is pretty aversive to, by intermixing both a structured school-like schedule in home, where that's supposed to be kind of our sacred place. This is where we come to escape school. Now we're just we're mixing up their environment. That can also throw off, throw them off. And so, yeah, if that's something that you guys are able to work with, I would really try to work on identifying just a space or an area of the home where this is where you do all school boring stuff. And then this is where you can be at home again. And this is where you have more of your leisurely activities.
Mm-hmm.
And then I'd also like to add that it seems that several school districts are making in-person education available to some kiddos with IEPs. Parents are telling me that their kids have qualified, so to speak, to return to in-person education classes. And so if that is something that a family does want to pursue, it's definitely worth checking with their IEP team teachers to see if their child is eligible for that, so that they can take advantage of that. It's definitely going to be something that's in flux, but if there is something available, it hopefully would be of benefit.
Thank you. Another emailed question that we received is, what do you believe is the most evidence-based practice and why? I'm assuming for managing challenging behaviors, is there a particular evidence-based practice that's recommended more than others?
I think you need to look at the behaviors. You need to look at what the topography is that you're evaluating, and you need to apply principles that are effective, that have been researched by other people, that have been shown to work and be successful. There are a lot of fields that have contributed to that research. Andy and I are a little bit more biased as trained behavior analysts into the research of applied behavior analysis. However, that's not the end all be all of all of the research. And so it's really more critical from me to look at what is the research, where is it coming from, do those authors, and is it peer reviewed? Is it something that has been replicated across places and settings? Is it shown to be effective for this particular group of people that it says is supporting it? So there are things that are research-based for autism that are not necessarily research-based to be effective for somebody with bipolar disorder, and vice versa. And so it's more important to be a critical thinker of what best practices of research is, and then apply that information to what you're looking at and what people are sharing resources about than any one particular field, especially when you get into cross categories with behaviors and disabilities and mental health and behavioral health. There are a lot of fields that co-align, and it gets more complicated than just any true single strategy.
Thank you. And we're right at the 4:15 mark. Andy and Betsie, did you have any final remarks?
I feel like Laura summed it up pretty well. It's very subjective to the child, what's developmentally appropriate, what's appropriate for that child, and how do you meet their needs. So I would work with whoever your clinician is. But I mean, whoever asked the question, if they just wanted some ideas as to what are some evidence-based strategies, I do have a list that I can send you of just different articles and different evidence-based practices for behavior interventions that they could look at. Me personally, I mean, I guess I could just say my bias and my favorite, and what I use in our children's setting is we structure our environment to use what's called a naturalistic teaching strategy. And so basically everything is naturally set up, and we use teaching opportunities. So learning moments and teachable moments to make sure that whenever we're trying to teach a replacement behavior or teaching a new skill, that it's relevant to that point in time, and it's relevant and motivating enough for that child in the moment. Because when you're trying to teach somebody to do something versus when you're actively doing it and learning at the same time, people tend to learn better when it's more applicable. So that's just my bias. But I'll send you the list of just articles and different intervention strategies that are widely used across this field.
That would be great. And it looks like there was some requests for recommendations for school counselors as well as how to best engage with those students. So if those are resources that we could upload, that would be helpful as well.
Yeah, I know of 2 research-based curriculum for more of those social group setting skills, and one is more focused on preschool early intervention skills, and one is more focused on transitioning to adults life skills type things. And so I can share that after the presentation or privately with Colleen, but I assume publicly would be better.
Yeah, thank you. Thank you so much, Laura, Andy, Betsy. I really appreciate all of you for willing to spend your time preparing this presentation and sharing this information. It was really, really important for us to provide this resource to the community, and I hope that everyone who participated today will continue to engage in our monthly webinars. Next month, we'll be talking about the youth crisis system here in Pierce County. We'll get to hear from different crisis providers, including Catholic Community Services, Mary Bridge, what to expect when a kid goes to emergency room, as well as what to expect if your kid gets hospitalized for behavioral health. So I think that will be a really good educational forum, as well as an opportunity to ask questions. I would also encourage everyone to go check out our Kids Mental Health Pierce County website. You can check out all of our past webinars as well as our resources and a lot of information about Pierce County mental health in general and the things that we're working towards. So I really encourage you to check that out. If you have any questions, my phone number as well as my email is there. Thank you again to everybody who participated today. If you need the notes, we'll get that as well as the live recording. Again, thank you, Laura. Thank you, Andy. Thank you, Betsy. I know we had such limited time, but you guys did an amazing job of covering some really challenging and difficult topics in a way that even I took some stuff away and took some notes too. So I really appreciate you all, and thank you to everybody who participated today. And with that being said, I'm going to end today's webinar. So thank you and have a great day.
Thank you.